You have so many disparities between the south and the north in terms of death, in terms of access to healthcare. But something that was very surprising to me was about my city, London, and they explained that every time you go to the east, you take the underground. Every time you go to the east and you pass one tube station, you lose 1 year of life expectancy. In a country where you have free healthcare, you still have disparities in terms of access to care, in terms of mortality and life expectancy. It's so unfair. There's something we need to do about it. It's very, very surprising to me. But it was just 2 days ago. I was just at Connaught Hospital, the main national hospital of Sierra Leone in Freetown, and we were in a meeting on the first floor of the hospital, and I heard a couple of ladies crying. So I just had a look at the window, and there was a young woman crying, and a grandmother, probably a grandmother, and there was a child of 4 years old who was standing without any expression. And I asked the ophthalmologist what was happening. He said that they had just discovered that the child is going to be blind for all his life. It could not be treated. And I explained what happened, what kind of disease. I'm not a doctor. I'm just a hospital manager. And he just said it's absolutely frustrating, because this child could have been treated in a few weeks, but they have waited 6 months trying to do from one traditional healer to another one, and they came to hospital far too late, and we could not save the child. And you had this situation completely unfair, where you have children who could be treated, easily treated, for nothing, for not a huge cost, or children who are dying for nothing. And all this injustice, this is why I work here. This is what I've been trying to do. Now, how to make sure that we stop this kind of situation, and that everybody can get access to quality healthcare. Now, there's a lot that can be done. It can be done through money. It can be done through giving time. It can be done by lobbying national governments in their countries. It can be done by trying to mobilize resources, convincing, for example, the diaspora to go back to their country and help. It can be done in developing countries by making the right decisions about treatment, making the right decisions about where do we need to invest resources, money or training. But this can be done by all of us, people from the south, people from the north, and I think a lot can be achieved. I was in the north of Togo, in West Africa, and I was doing an assessment in a few hospitals in the north, and I had decided to sleep in a village. And there was a kind of little guest house, just a one room, and I spent the night there just to experience the life of the village. And then and I came with a car, and I parked the car, and there was a family just in the next room, and they had a little boy, and I spent the night there, and I had just a mattress, and I didn't have any bed nets as well, big mistake. So I could not sleep, mosquitoes all around me, and very, very big mistake. But suddenly I heard some cries, and 2 o'clock in the morning, crying again. So I went next door and said, what's happening? We have a problem. Our baby has a huge fever and has been like that for the last three days. I said, oh, you should have told me that. We have to get the car and get to the hospital. And he said, no, we don't have any money. We're not sure. They had just nothing. They had one mattress for the whole family. We took the car quickly at 3 o'clock in the morning. We were having at the hospital, and we saw a nurse. A nurse took the baby with the family and waited at 6 o'clock in the morning, came back, and they said, look, it was malaria fever, and a few hours later, the baby would have died. He was dehydrated, huge fever, had received no medicine, and that's it. It's just a question of hours, question of days, but something had to be done, and just by chance it happened. But this situation is every day in all these villages.